A pro-life scientist based in Washington state is on a mission to eliminate human exploitation and medical research. Earlier this week, our Brian Patrick sat down with her to discuss alternatives to embryonic stem cells.
Joining us, Dr. Teresa Deisher, founder of AVM Biotechnology. That's a company dedicated to finding effective and ethical stem cell technologies. Dr. Deisher, you go way back with stem cell research. Just give us a brief background.
I have been working in the field of regenerative medicine since I was a graduate student. And in one of my first jobs, I worked on blood stem cell formation and then became involved in stem cells for organs outside of the blood system in about 1995, 1996.
And you started working with embryonic stem cells. And tell us how that brought about a major change in your life.
I actually wasn't doing embryonic stem cell research myself. There was embryonic stem cell research going on in the company that I was working for. And at that time, I was very pro-choice, very much a feminist, and really had no moral interest or religious interest in the area at all. However, scientifically, embryonic stem cells are problematic because they form tumors and they cause immune rejection and they're very expensive. And right at that time, I discovered adult pluripotent stem cells. And if you can get that kind of a stem cell from an adult, which we did, then embryonic stem cells are not necessary at all. And clinically, the best choice is the adult stem cell. It's just a no-brainer.
So the pro-life movement, you say, needs to really offer some good scientific proof and good positive alternatives when arguing against embryonic stem cell research.
Well, absolutely. It's not enough just to say no. One wants to explain why, and scientifically, there's sound reasons why we wouldn't use aborted fetal material or embryonic stem cells. And then because we care about people with illnesses, and we care about people watching a loved one suffer, we want to make sure that they get the very best stem cell they possibly could. And those are adult stem cells that are effective and safe. And they also happen not to harm anyone else.
So define an adult stem cell.
An adult stem cell is a stem cell that would come after birth. So even cells taken from the umbilical cord are considered adult, although sometimes they'll be called fetal, but they're taken after the child is born and there's no harm that has come to them. And other adult stem cells exist in all of our bodies.
Yes. So that is where the resistance comes from, is toward taking the life of an embryo, a child, but with adult stem cells that is not necessary, and the technology is so much better in that area. It's fascinating to me. We'll talk with you more about it next time you're in town. We appreciate you being with us, Dr. Teresa Deisher.
I look forward to coming back. Thank you.